My name is Jonathan Smith. I have the privilege of pastoring the Tucson Sharon Church. It's my home church. I'm also a fourth-year PhD student at the Mel and Enid Zuckerman College of Public Health. Well, as a pastor and assistant to the president for Black Ministries in Arizona Conference for Seventh-day Adventists, and being a member of the CAB, the Community Advisory Board here at the University of Arizona Cancer Center, to me it's really literally a match made in heaven. And that's more than just a cliche, but because of what we do in the community, trying to help people in the community with health and wellness along with spirituality, it gives me a platform and it gives me opportunities to be able to meet people where they are, and then at the CAB to be able to advocate on their behalf. One of the focuses of my program, health behavior and health promotion, we know cancer is the biggest cause, I think it's the second leading cause of death outside of heart disease. And the fact is my community suffers disproportionate along with other minoritized communities, Native American communities, pretty much the BIPOC community. And so it allows me as an insider to be able to share evidence-based information with them. And my focus is on primary prevention. If we can get people to change behavior through health promotion, we can prevent some of these cancers that come along with time. And so my goal is to impact people on the primary level before they get to these advanced stages of cancer. I wanted to be better equipped to help people in the community. And so focusing in public health, being able to advocate at the CAB on behalf of people in the community allows me to engage in holistic ministry. I work in the College of Psychology in the psychosocial research on oncology lab. Again, this is about trying to prevent cancer. However, this particular program focuses on collaborative care for people who are uninsured in our catchment area. Our goal is to be able, in this case, to provide cancer care to those who are uninsured and to make sure that care is collaborated with our partners like El Rio and other programs in the community so that these individuals are connected with resources to provide a continuous cancer care. Being on the CAB and on the grant committee, it gives me an opportunity to be able to share in sermon how people can make choices, change behavior that can have a positive impact. Because of all of the research and the articles that are being published, I'm able to share with my parishioners evidence-based information that can have a direct impact on their lives. And so it helps me to take that research and evidence, put it in layman terms, if you will, so that my congregation not only can understand it, but they can also benefit from it as well. Well, I think it's very important that every NCI that has that designation should have a community advisory board so that there is a voice from the community as stakeholders, and that this is just not about going into the community to get participants for research, but there are community advisors that are also there as stakeholders that can give voice to make sure that there is equipoise, as we would say, so that this is beneficial not only for the University Cancer Center, but it's also beneficial for the community and for research.